Janet's a patient who had a platelet-rich plasma injection 6 weeks ago into her lumbar spine. Her lower back is 60% better. Today she still has some pain down her leg and in the groin, as well as in the knee. Her imaging came back with arthritis of the knee as well as the hip. And today I'm going to do an injection of PRP into the knee joint and more into the hip because that appears to be her main problem. And under x-ray later we might do something in the sacroiliac joint or by the exiting nerve roots. But for now, under the ultrasound, we're going to examine her knee. I'm in the suprapatellar position, and you can see here as I scan distally, we could see the suprapatellar tendon, and below it is the fat pad. Can you straighten your leg a little bit more? Good. Thank you. I'm also going to reverse my orientation so it's consistent with the patient. So here we see the rectus femoral muscle with the tendon inserting into the suprapatellar tendon right here. And as I rock the probe, you can get onto the patella and see the bone. Right here. You have the bone and fat imaged on the T mode, as well as the space between the fat pads, the prepatellar fat pad and the suprapatellar fat pad that leads into the joint. And that's the black space between the fat pads. In a transverse section, I could see a cross-section of the suprapatellar tendon on top. And it looks irregular because she has arthritis. This is not a normal scan, so the anatomy is a little bit off. Can you straighten your leg just a little bit, please? B mode. There's some fluid above the fat pad, and that would be our target location. I'm just trying to optimize it right here. Bend your knee a little more. Thank you. Here's the trochlear, this little divot right here. And there you can see a little effusion between the suprapatellar fat pad and the prefemoral fat pad. Can I have an alcohol swab, please? I'm going to inject only a small amount of PRP here because her larger problem is in the hip. And that's where I'm going to focus the majority of the injectate. Now, I'm going to come from a lateral approach. As you notice, the PRP is red, it's blood tinged. There was some blood that got into the PRP, a small amount, which can cause some more inflammation. But when you do get blood in the sample, you do get pretty much all of the platelets. You're not missing out. So there's going to be a little pinch, Janet, okay? Pinch. And pop right in, right there. And